afternoon. It's 12 p.m. Central African time on day 715 of the lockdown here in South Africa, coming to you live from our Auckland Park studios. This is the first hour of On Point. Thank you very much for being with us. I'm Nompumelelo Siziba. Gauteng Health MEC Nomathemba Mokgethi is today visiting the Hani Baragwanath Academic Hospital. This comes after the hospital staffers held a picket yesterday. Healthcare workers raised concerns over staffing challenges should government not renew over 800 temporary COVID-19 posts. They warned that the termination of the employment contracts could lead to the collapse of the healthcare services in the province. Well, for more on this, we now cross to SABC News reporter. We'll now cross to a live crossing, a briefing that's taking place by the MEC.
That, the compensation of employees when you have been given a particular budget, you can't actually tamper with it. And with that particular budget, we have been able, to appoint various specialists and various occupational categories, whether it's in the core of managing COVID or in the support of, in those particular areas. So we have received, the budget for the 2022 and 2023 financial year. That is, the initial budget for the 21-22 was 2.2 billion, and now it has been reduced to 1.1 billion. That on its own poses a challenge as to what do we do with the current staff that are there, regardless of the fact that, their contracts were coming, to an end by the 31st of March. What we have decided is we have met with all the CEOs to look into the matter, reorganize, and explain to us where the need is in terms of, filling those particular positions. Unfortunately, with that 50% cut of budget, we won't be able, to reappoint all the employees that have been appointed through COVID. We understand that it's still with us, but we cannot even at this particular point in time reappoint all of them because that will be highly irregular and exposes us to unnecessary audit queries with the Auditor General. So at the moment, we would like to state it very clearly that, the number of staff members, that are involved, it's not true that it's 800 doctors and nurses that are going to be released. But that is work that we're currently doing to ensure that, for instance, if Steve Biko does not need 3 more doctors, what they will do is that the doctors will agree, if the doctors are needed at Bara, that Steve Biko will now reorganize that funding for the 3 doctors and redirect it where it's needed. So we are now waiting for all the CEOs and clinicians involved on this project to advise the department as to, with that 1.5 billion, how are we going to reorganize staff to ensure that we are not compromised, as I've stated earlier, that COVID, it's still with us, and we wouldn't like, to appoint employees at this particular point in time without adequate budget, because we will end up with the same situation that we had, with the medical interns, that were appointed without a budget, and later on we might not be able even to pay them. Thank you.
I think I didn't talk to issue of medical waste.
Yeah.
Okay, through you, MEC, maybe there's a need for me to also just deliberate a little bit on the outstanding payment or waste management relating to the 2 companies that we have employed as or that we have contracted as Department of Health. There's been a lot of media hype about the department not being able to pay these suppliers. But I must confirm that these suppliers have been paid, and they have been paid on a monthly basis without fail. It may be that we are not necessarily paying the full amount that they require, but we have been paying these suppliers on a monthly basis. The issue of Buhle Medical Waste as one of the contracted suppliers who are now servicing Charlotte Matreke, we have had communication with the service provider indicating, the need for them to continue servicing the organization. They have made that commitment, and based on what we have paid already, they have resumed duty. So there has not been a challenge with regards to Buhle Medical Waste collecting medical waste on site. So I must say things are now back to normal, and we ensure that there's no disruption like this that happens ever again. We don't want to hold any payment of service providers, but we want to make sure that we have that good working relationship with companies so that we can then, receive the service that is due to them, and we also receive or pay them on time as and when there's a need for us to do so. So I think there was just a need for me to deliberate on the issue of bushel waste, that the company has now been paid and they've resumed duty. Thank you.
Thank you. Let me see. Were you indicating that the son that this year first left?
No, I was saying
Okay.
I sit there.
Oh, yes. I think what we're going to do, thanks for that update. I know that there's probably follow-up questions that will come from the floor in terms of what has been said. Maybe what you just needed to get to clear as well is for the CEO to just clarify, because I know that yesterday, CEO, you had some of the team members here protesting outside on a number of things. The issue that has been in the domain, issue of food and the bread issue, just to provide context and clarity there as to has that matter being addressed, what is the issue there?
Okay. Good morning, MEC and colleagues, members of the media. As a hospital, we had challenges with the delivery of bread only, as it has already been articulated by our principals. We did not have any challenge with any other food items. Patients were getting their normal breakfast, their lunch, and their dinner. But bread is necessary because dinner is served around 5 o'clock. Therefore, it's always critical that in the wards, there is bread available for people to have snacks. It doesn't mean that we are not giving them other snacks because bread was not there. Especially people who suffer from diabetes, for example, they need to have snacks in between the meals. So with the assistance of our dietitian, snacks were provided according to to the disease profile of the patient. But patients, I think they prefer to have bread. The community that we serve, they prefer bread. So even if you gave them alternatives, the unhappiness about bread still remained. But as a hospital, we had mitigation strategies in place. For example, we are procuring bread from using petty cash. We're also baking bread in our own kitchen. But as the principals have already said, the supplier has been paid, and we do hope that going forward we'll receive a delivery of bread. So that is the situation regarding bread. On record, we didn't have any other food items shortage. That has to be corrected. Thank you.
Okay. Thank you, CEO. I think what we're going to do, I'm just going to maybe allow members of the media, we will take 2 rounds by show of hands, and then when I point at you, you will introduce, at the time when you're speaking, you will introduce yourself and the media house you are from, and then pose your question. I'm not going to allow dialogues. If you've got 2-3 questions, you pose them, and then if you feel that your question has not been responded to, you will raise your hand so that I can be able to pose you, because I see there's quite a number of you, so we respect even other people that are here that still need to ask questions. You are allowed, when it's your turn to ask questions, to ask the number of questions that you need to ask, and we'll direct them into the relevant people. I see there's one hand here, there's hand number 2, there's please when you raise your hand, look this side, that when I say 3, you know that I'm talking to you. It's 3, it's 4. Okay, I see 4 hands for this round. I'm not seeing anything that side, it's only the 4 hands. It's 1 here, it's 2 there, the back is 3, my sister there, and then it's 4 this side. In that order, if you could please raise your questions.
My name is Malunga Boy from Newsroom Africa. I just want to get a sense. Is the department in financial crisis? How much money does the department have right now? And what are you saying to a person who relies on the public healthcare system? Because in this province, we've heard some of the clinicians here yesterday saying that the health system in Gauteng is actually quite appalling. And also, I just want to get a sense on the issue of the contracts, of the COVID contracts. Can we get a clarity then as to how many people are affected there? Because I hear that you're saying that they're not going to be fired. Can I just get clarity on that as well? Thank you.
The second hand?
EMCA. I think some of my questions are aligned to what my colleague has asked, but nonetheless, maybe just for iteration purposes. The first one to the CFO. Just a clarity there, you said you started with about 59 billion, and then you said you had to incur some of the costs from the previous year. So just a clarity of where the budget stands right now, and if it is enough to carry you until obviously the next installment of that budget. To the CEO of Baragwanath Hospital, the picketers yesterday were raising issues of saying they are short-staffed already and that they need some of these members that will be let go. Just perhaps if you can tell us in terms of the capacity of the hospital, do you have enough hands or boots on the ground to actually carry out some of the issues around this particular hospital? I had another question, but I should write this down.
Okay, the third one there.
I'm Yoga from New Frame, and I'm just going to echo some of those questions that have been asked. But just with regards to the number of staff, I think one of the other issues that was brought up was that doctors and nurses were having to carry patients themselves because of the lack of porters. Is there a plan to increase this as well as cleaners, the number of staff around there? And if so, where will that money be sourced from? The second question was just with regards, I think it's also been asked as well, how many men have their contracts renewed? I believe you said it's not 800, so if we're getting the number 800, what is the correct figure? Can you just give us insight into that? And then the final question was just with regards to the Financial Health Department, which I think Manuel has already asked. But I wanted to specifically spearhead the question by asking if the department is currently feeling the effects of the PPE corruption scandal from last year.
Okay, there's a fourth question this side.
Yeah. Oh, thank you, DKZ from Soweto TV. Firstly, I would like to ask our CEO, Mamkele, we only have allegations, or the MEC has only talked about food, but there are also allegations of Bara Hospital struggling with resources like there are no enough beds, there are no enough blankets, and also pillows. So besides Ishiadi, there's also those resources and also infrastructure which is old to be used or utilized by our patients. Again, the question of how long did the hospital run out of bread, because it is alleged it has been 3 weeks and doctors and nurses had to use their own money to buy bread for our patients. Thank you.
Okay, before I ask the question, maybe just to get clarity, you say an infrastructure that is old. What exactly are we referring to? When you say infrastructure that is old?
Beds.
Sorry?
Beds. Yes.
Oh, okay, yeah, because infrastructure that is old can mean a lot of things. Okay, it's beds.
Like buildings.
Yes. Maybe what I should do, because of the sitting arrangement now, I should allow the CEO for Bara, because she's already sitting close to the mic, just to take up the issues that were specifically raised that relates to the facility before we move to the other ones.
Okay, the first question is around the staff shortage at Bara. Bara has got a staff establishment of just over 7,000 posts. But however, some posts over the years have become unfunded. So those posts we can't fill due to financial constraints. However, right now we've got warm bodies is around 6,200 odd warm bodies. And as and when posts become vacant, we fill them. Obviously, those that we have funds for. We cannot fill unfunded posts. However, I must also put it on record that the staff establishment at Bara is not aligned to the workload at Bara, especially now that we are also carrying the burden of the closure of Charlotte Maxeke together with our sister hospital, Helen Joseph Hospital. So the volume of patients that normally come to Bara is huge. It is huge. I mean, if you can go to our clinics, on average, our pharmacy, the head count in pharmacy is around 1,200 per day. And we admit, maybe depending on the season, it can be up to 10,000 patients per month that we admit. If you check at our delivery rates, it's high. We are the biggest hospital in the country and in the Southern Hemisphere. So we just don't have enough hands, to man the workload that we have to carry. So there is a need for the staff establishment to be reviewed, and that is a fact, so that we can then, as a department, see how then resources are always limited. See how then can we work together to make sure that we support the areas that are under great pressure. So this COVID-19 post, they were really they were a great help to us, especially as I've already said that the workload has been increased. So I think the protest really is not really about the fact that the posts are going to be terminated, because we are aware that even the employees are aware that they were contract posts. And when you look into the situation in the country as well, generally there's a high unemployment rate. So when somebody has been employed temporary as it was, and knowing very well that the contract is going to end at some stage, I'm sure it is natural that people would love to be retained. But we are unable to do so as a department because of the pest that is available. So I think the protest was more, for me, it's not really about the COVID-19 post. It's about the staff shortage as it exists, and the fact that we had these posts that made us realize just how far we can stretch with additional posts. But we recognize the fact that you can only appoint within a budget that is available. So that is the issue around posts. And then consumables, no, we do not have shortage of consumables. We do have enough consumables. I said the shortage was around bread. Other food items, dried grocery, we don't have a problem. But the issues around linen, the challenges around linen, talks to the operations in the laundry and also the support services. For you to have linen available, you need to have boilers that are functional. We've got 4 boilers here at Bara. We've got then the laundry that's got tunnel washers that must be functional. You need to have ironers that are functional. So the support around making sure that the equipment at the laundry is optimized so that the laundry can then be able to supply to Bara. And you must remember that the laundry here at Bara does not only supply Bara. It supplies Bara, it supplies Begim Langeli, it supplies Leratong Hospital, it supplies Yusuf Dadu, Carltonville, and all the clinics around Soweto. So we need to have laundry that is functional 24/7. Because if you've got 1 out of 4 tunnel washers working, clearly we're not going to have enough linen. So those are the issues that collectively with our colleagues from Public Works, because they are the ones who are our agents in terms of making sure that the infrastructure is correct and that the equipment in the laundry is serviced. We need really to improve in that area so that we can then, the linen that is available can be turned around so that we're reassured that whenever we need linen in the wards, the linen is available, because this is about dignity of the patient as well. So the struggles around that is around really other support services that must come on. And of course, as a hospital, we also need to procure linen within the available budget that we have. Some linen gets condemned in the process, we have to replace. So all of us have got a role to play to make sure that things work well along the entire system. So as customers, we're each other's customers. So if there's one area that is not serving another well, then the system is under strain. So that is about linen availability. I don't know what else should I respond to. Staff buying food for patients. Let me just say that, as I've already reiterated, that the shortage was only around food, and that the hospital bread, and the hospital had some mitigation strategies. Maybe the strategies didn't go far enough. As I've said, that if you procure bread from petty cash, you can't get 545 loaves, you get less. But it doesn't mean that there was no alternative. It's just that our patients preferred bread, even if they were getting fruit and yogurt or whatever, but they preferred bread. So I think nurses, of course, advocates for patient care, and nurses are in front of the patient. So if I'm a nurse and this patient is complaining that he prefers to have bread, and there's not bread, I actually applaud those nurses that it's not all the nurses. It's not as if nurses were asked to go and buy bread for patients. They did it out of the kindness of their heart. And I, as the accounting officer, I don't think I'll actually thank them, because they were facing with a patient and they were reacting to a crisis. It's not that there was a crisis of food. The patient wanted bread, preferences. So if nurses do that, I myself have done it. So I can only say, because we are supposed to be caring, and we're saving vulnerable communities, and it's a crisis situation, so it shouldn't be seen as if nurses were forced. We said nurses collect and go, or management said no, it's not like that. But I must say that it's not all the nurses, but I thank those that did that, because they were responding to an immediate need on the ground, because the patient had their own preferences. We're not starving the patient. I think that should be on record. We're not starving the patients. So that is the issue around bread. I don't think there's anything else that...
For how long?
For how long? Since the problem started mid-February. No, mid-February. That's when the delivery stopped.
Can we say 3 weeks?
Yeah, roughly 3 weeks. Yeah.
Thank you.
The beds, we are gazetted for 2,880 beds, but we've got enough beds. When we say the beds, shortage of beds, it's not as if there are no beds. It's because the hospital is overcrowded. We've got beds, we've got equipment. It's the space issue because of the volume of patients that are coming here. And sometimes the communities don't understand when you say we don't have a bed. They think, can I bring you a bed now so that you can admit my relative? No, it's because you have to work within the beds that are gazetted, and you can't go beyond those gazetted beds. Thank you. I don't know if there's anything I haven't covered.
To all, yeah. Perhaps maybe the second issues would be the CFO issues. Maybe when the CFO is taking the seat, just to provide clarity. The 800 number was raised by doctors here at Bara because the COVID appointments here, there's about, I think, 800 or so that were made here. It's not 800 in terms of the 8,100 posts that were COVID temporary posts in the province in the previous financial year. And I think that's where we need to get our facts straight, that the 800 number was specifically taken to people here at Bara to say we were losing this number, this post and so forth. And what the response we are being given here is that we're talking about a provincial picture of having 8,100 posts across the province. And of that, you need to then rationalize in terms of saying what will then be prioritization. And I think DG has spoken to that in terms of facilities being able to look at those and then being able to determine what needs do they need to prioritize given the budgetary constraints. CFO?
Thank you, colleagues. Honestly speaking, the department is not in a financial crisis, and that we must state openly. The one thing that we should take note of is the fact that funding for health is one of the key priorities in the province. So of the 59 billion that we had received as part of our adjustment budget, we had already spent about 80% of that allocation in January. As we speak, we have about 11 billion that we still need to spend by end of March. And that is now money that we say we will spend 100% by year end. There may be issues of underspending on certain areas, especially on the conditional grant funding, but in the true sense of the matter, we are expecting to spend at least above 95% of the current year's allocation. So we are not in a crisis mode when it comes to funding. What is allocated to health is adequate for a financial year. Of course, there are other needs that we have, and through our budget bids, we then present such cases to the Provincial Treasury. But in the true sense of the matter, we have enough to cater for the needs of the organization now. And there was a question that was asked relating to whether we're feeling the effects of PPE for the year that took place since 2020 or 2021. Yes, we do. Remember, I spoke about plus minus 453 million worth of invoices for works or deliveries of PPEs that were done or that were delivered in by end of March 2021 and could not be paid. Because SIU had their own investigations, we had to wait, and only when those were now completed did we start paying these kind of service providers. And we only paid those that were cleared, as in they delivered, and they delivered quality material, and therefore they deserve payment. So of that, we felt the impact, of course. I mean, 450 million is a lot of money that we could have serviced other needs of the organization with. So we had to carry those invoices and ensure that they are paid in the current financial year, which obviously had an impact on the overall budget of the organization. So yes, whatever happened in 2020 had a major impact on our overall baseline allocation for the department. I'm sure DDG would want to answer on the question of the number of employees recruited on PPE or on COVID-19, or must I talk to that? All right. Remember when employees were recruited or appointed for COVID-19 posts, we did not start in April with 6,000 or 7,000 employees. We had to bring them in the system gradually as and when we went through the waves. The second wave, the third wave, and the fourth wave, that's when then, based on the needs analysis, we then had to recruit these employees. But by end of February, we had recorded at least 8,500 personnel, clinical staff and also administrative support combined. 8,500 recruits that we brought in the system, whose contract is now ending now on the 31st of March. So based on the budget allocation that we had, remember the DG spoke about 2.2 billion that we had on recruitment of these personnel. There's about 1.1 billion that is now going to be given for the year 2022-23. That is the year that's starting now in April the following month. So we can only talk to plus minus 50% of what we can now employ as part of recruitment process for COVID-19 patients. So post. I think I'm just... Okay,
Okay, yes.
DDG, you can come.
I think there was a question, on that providing clarity on how much money we have. I think you've provided that.
Yes, we have 59 billion. We've spent 80% of that by end of Jan. By end of Feb, we were at least at 83%. So far, we've got plus minus 10 billion that we need to spend. And remember, the 10 billion is paying salaries of employees. It's doing infrastructure. We're making transfers to NGOs. We're also buying goods and services. So all that will now cover our projected spending. Obviously, we don't have 4.5 billion that we carried through from the previous year to now. But as time goes by, we will see a reduction on that particular balance.
CFO, just before you change, perhaps the issue around accruals, maybe you can just provide a bit of clarity. I think sometimes when you talk of accruals, it's a financial language that people sometimes don't understand. When you say we had to spend so much money from the previous years, the question that comes from someone is that, but why didn't you reserve that money because you knew that you're going to need it and use it to pay? Maybe just clarify that.
Okay. There are serious, or let me say historic issues that are really affecting health, and some of them it's not only on the basis of underfunding but how we then controlled our finances from a procurement point of view until we pay a service provider. There were challenges in the department, of course. The demand is too high. Remember, Gauteng is the hub of the economy in terms of the needs of the country itself. So the more we have an increase in population, the more we spend on health needs. We cannot say because a person is not Gauteng-based, we then chase them away. So over the years, we've been having invoices that we are carrying through, unable to pay for months, from one financial year to another. So we have got transactions that are dating back to 2013. 14 financial year. It's small amounts, but those are invoices that which we are also not saying we are paying because we have to pay. There's a need for us to pay. We need to conduct reconciliation and say, why did we not pay you in 2013? Why are you claiming it now? And are you really saying we did not pay you? Can we see the receipts? Can we also see the bank statement? So these are things that which we are discussing with service providers, but we are clarifying those balances as and when we are discussing our invoices with these service providers. Maybe let me also just deliberate a little bit as to what we have done to improve the system. In the year, by the time the year 2020-2021 started, that is like 2 years ago, we had an accrual of about 5.8 billion. And these are now invoices that we're saying work has been done, services have been delivered, but we could not pay because we ran out of cash, we ran out of a budget. When the year began, we obviously prioritized those kind of invoices. But remember, as the months go by, we do require services from different service providers. And because we've paid the 5 billion, there's another 5 billion that is now increasing. 1 billion this month, next month it's 2 billion, next month it's 3 billion. And those are now invoices that we've been carrying through month to month. What we've done so far, we've just looked into the overall report of the department and really try and understand as to what is it exactly that we're saying we are owing to these service providers. Do we really owe 5.8 billion? As and when we do an analysis, we come to find out that some of these transactions are duplicates. The service provider has submitted the same invoice number 3 times. And if you look into those kind of transactions, you're really saying, but I know I only owe 1, I'm not owing 3. So those kind of analysis that were done had then brought the balance back, including those that we say, yes, here we know we owe you and we have to pay you. So we came to a concluded balance of about 4.2 billion by end of January this year. So we are saying, as far as our records are concerned as Department of Health, we've got invoices to the value of 4.2 billion from 5.8, that which we know we are saying confirmed. We do owe the service provider. The issue is now, how do we control payment of these service providers now and reduce the increase based on the demand from supply chain point of view? Because remember, every day we place orders. Every day there are deliveries made. Every day invoices are coming in. How do we control what is procured so that we can then focus on payment of these service providers and reduce the balance of accruals? So accruals basically, or in a nutshell, would mean invoices for services that have been rendered in a previous term carried over into a new term. I'm sure I'm clear. Thank you.
I think responding to all the issues that were raised here, perhaps I'm going to allow a second round of questions, and then once we're done with that, then the MEC will just give some closing remarks before we wrap up the briefing. If I can see by show of hands, I will first prioritize those that did not speak, and then if you had spoken previously, I'll take you last. I think there was, let me start there. Okay, you have spoken 1, there the back, 2, 3, and then because there's no other hand, then you'll be 4. Okay? Colleagues, in that order, we can start. There the back.
From so in terms of the COVID-19 staff that's been retained for this year, how many of those staff members are the Cuban doctors that have been employed to the country?
Okay, 2.
My name is Priya from Sregata newspaper. We've got so many doctors around, they qualify, finish up after 2 years, after their 3rd year, and they're not getting placement. So now we're having a shortage of staff within not just Bara but other hospitals. What's going to happen? Because these doctors are actually leaving the country, or they're sitting at home needing to study further because nothing else is happening. So what's going to turn out with all these doctors? Because now we've got shortage of staff, and we've got doctors that are sitting at home or they're leaving the country to go and work elsewhere.
Okay, I think that's yes.
Mia Lindviki from Eyewitness News. I spoke to one of the bread suppliers who basically detailed to me how he had to go and borrow money to pay and go and buy the bread for the last 2-3 weeks now. I mean, surely that is more than just a problem. I mean, when you've got a good relationship with service providers and you literally have to allow him to go into a financial crisis himself so that he can continue to supply patients because he's got a good relationship with the department and he doesn't want to lose the contract. How can we allow something to get to that extent when you say yourself it is a problem? And have you escalated this maybe to seek for help from the Gauteng government or even national structures to go and get help to say this is a problem? We've been battling with this problem of paying our service providers for years now. How can we sort it out from a higher level? Thank you.
Last hand there, the back.
Yes, again from ENCA. I think first of all, CEO, sorry to just bother you again after such a complex cover. But in an ideal setting, how many staff members, how many warm bodies, as you put it, would you require to have a fully functional hospital according to the demand that is? And perhaps CFO, if I can bother you as well again, the issue of the 4 billion that you mentioned is still outstanding. Is this now included in the cost that you will have to go through to get too much? just in terms of that, because you did say you had 10, 11 budgets left in terms of the billions that you have. And MEC, I'm sure it's also bother you. The issue of ESCOM, I spoke to Denosa yesterday, the nursing union, and they spoke about some hospitals that have issues with generators. In fact, they did say that in Sweden they have experienced that some generators do not come on when some of these load shedding things kick in. So in a sense, he had benchmarked this servicing of generators to Western Cape, saying that they do it each and every week. Just maybe bring us into speed in terms of how often these generators are serviced, and if there is indeed an issue around generators, and perhaps a general cover of, in fact, being load shedded and not being prioritized as a point of clarity when it comes to this load shedding. That's what the dealing is there around ESCOM. Thank you very much.
There's a last hand here. This is the last one, that one day. Yeah,
see, I just want to, it's something that you said, you acknowledged that, there are staffing issues at Chris Hani Baragwanath Hospital, but I want to understand, how is that then impacting on patient care in this particular hospital? Are you satisfied with the care that people get in this particular hospital when they leave? Thank you.
Okay, yes.
Just with regards to the crisis that's going to ensue once this is all taken place, we are still in the midst of COVID, but from what I'm understanding, there's a number of diseases that are now at the back burner just because COVID is being prioritized. Is there a plan by the Department of Health to get ahead of this? You had mentioned, CEO, just with regards to the amounts that you now have a burden that you've had to take on with Charlotte Matlagak closing down, but is there a contingency plan to ensure that health services are still continuing, that TB, for example, HIV, heart disease, all the others are not, cancer are not put on the back burner? And then the second question is just with regards to the accrual. It sounds as though it's also more reactionary as opposed to a long-term plan as being put in place to ensure that this doesn't happen again, or to ensure that we're not dealing with a 2013 claim in 2022. It also sounds like you're saying, there's still orders that are going to be placed, but what exactly is the plan to ensure that this doesn't happen again? I don't think it's fair to say I'm glad that some staff did 1, 2, 3 to help out, although they weren't forced. It's seeming like it's trivializing an issue that really could put the hospital on the brink of collapse.
Okay, I think thanks for the questions that have been asked. There are some that I think when the MEC does the concludes, should probably move into that, especially as it relates to the catching up in terms of other health programs, what the department is doing in terms of that, and then the issue of the staff shortage and an impact on patient care. I think that question was addressed to the CEO, but I suppose that the MEC will also maybe touch on it a little bit closing, just broadly. But the CEO for Bara in particular will deal with it. And I think there was a question as well that was raised by one colleague in terms of the issue of staff complement, as to whether how much we need to have full. I think if you were to go globally and look, I don't think there's any one of us here who can point at us one health institution globally where they've got 100% full staff complement. It never happens. Even if you go to the best in the private sector, you'll never have 100% staff complement. So I don't think the aim is that you are saying if we have 100% staff complement, you won't have the challenges that you have and so forth. You need to strike a rational balance in terms of areas that are critical. There are still areas, for example, that are very highly specialized, and there's very few people that you're going to have. And lastly, before I hand over to the panel, the issue of doctors leaving. We will also need to deal with the perception that Gauteng must employ everyone and everyone. It's not possible that Gauteng might be absorbing a lot of people in terms of training and so forth, as we've seen now with the medical interns, that we were given in excess of over 400, over and above what we've got a budget for. We still accommodated those people and we still provided training. But we are not training and developing for Gauteng. Remember, people who come here, they get trained and so forth, they go elsewhere else around the country for them to be able to provide services. So I think we should move from that particular premise in terms of saying, while Gauteng might be the center in terms of the level of services and so forth, but that people that have been developed and trained are not necessarily developed and trained solely for Gauteng, but it's for everywhere else in the country. Yes, we do have a large concentration of medical facilities that are, universities that are training your doctors and so forth, but they're not training for Gauteng, they're training for the rest of the country. Let's go back to the panel in terms of CFO. You're still, the mics are still facing you. We'll start with your issues and then we'll escalate to the other, we'll come to the CEO. And I think maybe, DDG, if you can indicate, I think some of the issues, especially or that are HR related, that maybe you can be able to touch on as well. CFO?
Thank you. I would, honestly speaking, the 4 billion balance will not be paid in 1 month. We would not be able to cater for that. Remember, there are commitments that we cannot do without. Based on the actual services that health renders, we need to make sure that patients have got food. We need to make sure that there's medicine, there's electricity bills paid, there's utilities paid, medical gas supply. So we prioritize payment of transactions where we know we don't want to experience any crisis. Not that others are not important, but in the true sense of the matter, what is critical is for us to ensure that at least what is committed, based on the contracts we've signed with different service providers, is catered for. The balance of accruals that are there would not only speak to general services that we are receiving as a department. Some of them are critical, of course, but we do face challenges again with different service providers. Not all of them require payment, and all of them are not compliant with tax clearance certificates. So as and when we go on a monthly or on a daily basis, we then resolve this kind of issues. We may carry a number of invoices based on services that are rendered now and until end of March into the new financial year. We don't know what the balance is going to be. But with the money that we have currently, we would be able to at least service or make payments to relevant service providers as and when we process accounts on a daily basis. And the question that was asked relating to bread supply, where the supplier went to borrow funding. Honestly, we know we deal with the SMMEs and people who are really challenged when it comes to issues of cash availability on a regular basis. We are trying by all means as a department to ensure that at least every month there's a payment that is made to the service provider. I can show records of payments that we've made to the service providers in this facility as to how much we've paid. I may be owing you 13,000 and only pay you 9,000. To me, I am obligated to pay you 13,000, but it depends also as to how quick you also submit your invoices as a supplier and whether you are compliant with your tax clearance. That would then enable me to pay. Of course, I'm not saying the system is all working well, but there are challenges that which we know we can resolve as a matter of urgency, and some of them might require medium-term kind of resolutions. We have sought help. We have sorted help. I think when I started, I spoke about a budget of about 56 billion, which was then increased to 59 billion during adjustment estimate. So this literally says we've been speaking to treasuries and saying health has got a needs analysis in terms of the budget. Can you then, subsidize or augment what has already been allocated when the year started? So we find ourselves being in a situation where yes, Treasury is supporting, the Premier is supporting through the Office of the MEC to ensure that there's additional funding received by the organization. Obviously, based on the demand, we can never say, demand matches supply in terms of financial resources. I think that's all from me.
Okay. I think the issue one.
Yes, the issue of the ideal staff establishment, I think it can only be fully answered once, as a department, we know what staffing norms are we working on. Because the staffing norms will depend on the acuity level of patients. For example, if you are in an ICU patient, I know here at Bara, depending on the acuity level, the ratio that the clinicians prefer and they say is best practice is 1-on-1. Especially if the patient is very ill and needs multiple organ support. But clearly that will not be the same for a patient who's in a general ward or who's in a high care situation. So for me to answer that correctly, it means that we need to do a work study based on the staffing norms that the department would have approved, so that we can then assess ourselves and say, as Bara, we've got so many, what is the acceptable doctor-patient ratio? What is the acceptable nurse-patient ratio. And then we can give you a definitive answer based on that. But in the meantime, what we are doing now, how we are coping, we also use agency staff. We use in-house hospital overtime, our own employees who are doing overtime to compensate, as well as we procure services through nursing agencies. That's how we are currently coping. Are patients satisfied with care? I think that we cannot assess ourselves. Am I satisfied? I think with what I think I'm satisfied because I think patients our staff are going way beyond the call of duty to mitigate. And I must say that because you need to have feedback as well from within the resources that we have. I'm satisfied that people are doing the best they can. But for you to get feedback from the users, then we do yearly patient satisfaction survey. So from that perspective, 2019-2020, our score was 84%. 2020-2021, our score dropped by 2. We are now at 82%. So that is when we ask the users, rate our service. But of course, we also are supposed to be doing daily in the wards, daily patient satisfaction of care, so that we pick up issues and then we work on them. So yeah, that is. I don't know what other question do I have to respond to. Those were the two questions that you asked.
I think if you have covered the questions that needed to be responded to, MEC, I think it's your turn now. Perhaps while the MEC is also responding, I think it's also important, as the CEO was making reference to the patient satisfaction survey, that generally in Gauteng, through the Gauteng city region, there is an annual perception survey that is done. And I would want to encourage members of the media to also have a look at that. And you see in terms of the issues that people have raised as top priority, in terms of issues that really, really concern them, where they think that if these areas were to be addressed, you will see that in terms of the outcry, health is important because it touches everyone's life. But if you look at those for the last 3-4 years, look at the priorities, health is not among the top 5 priorities. From the residents of Gauteng, I'm just answering the question in terms of the issues of patients' perception. Obviously, health impacts everyone because it touches every area of life, and hence we are here now, even discussing the issue of health and so forth. But we do know that in Gauteng, there are certain services that residents of Gauteng have put in order of priority in terms of where do you start. But that does not say health is not important. Health remains critical because we need a healthy province for us to be able to, I think, function and have a province that is thriving. MEC, there are a couple of issues that I think you want to perhaps address, and then maybe you give us those closing remarks.
Thank you very much, Madam Daltal. I think the question that I need to respond to, with regard to the ESCOM issues in Sebokeng Hospital in particular, that issue was brought to my attention. And the Department of Infrastructure Development is our agent. So they are supposed to do statutory maintenance on all the generators, especially now that we from time to time have load shedding issues. So I was informed that they did inform DID, so that JD can, on an emergency service, I can appoint a service provider that can be able to make sure that that generator is working. And then with regard to the other diseases, I know that there's someone who asked about other diseases. We did not drop other dealing with other diseases like your TB or HIV services. They were continuing. Yes, we had backlog on surgical operations or surgical backlogs, but we did manage to address them because I know that doctors were doing a bleed into making sure that they address those backlogs. And then with regard to future plans, especially now that the numbers of COVID are decreasing or declining, we are going to integrate COVID management into our day-to-day activities. And then the other thing that I also want to raise is the patient community distribution medication. we are registering patients on what we call a CCMDD, so that we don't find a lot of patients in our clinics and hospitals where chronic patients who had been stable on medication for something like 12 months, 6 to 12 months, are delivered medication at their houses when you registered. Or you can also collect medication at our dispensary points, which is contracted with us, which is a Discam and Clicks, so that you don't have to, you are stable, you don't have to queue to queue at the clinic just to go and get your chronic medication. And that has worked well, because I think we have on our register now more than 1.3 million people registered. So we are raising this awareness that to our communities, that being on radios, to make sure that our communities understand that you don't need to, when you are stable, you don't need to go to the clinic monthly to collect medication. So in closing, I'm also maybe going to inform the colleagues from the media space that we appeared in our finance portfolio committee yesterday. They are aware of the challenges, and they've also pledged their support, and they also applauded the department where we are doing well. It might not be noticeable now, but I must say for the year or so that I had been in the department, there has been some positive outcomes, or we have improved on other services, or on other control measures, or on other objectives that we have to reach as a department. And then we are also committing that we will continue working with other stakeholders, as we also going out on stakeholder engagement. And the Premier has made commitment, I think in the SOPA, that every clinic or house or unfinished projects, we need to make sure that in these 2 years we complete those. So we are really making sure that we engage with the agents or the people who are assisting us to make sure that we deliver on those, we engage with them. And then I am also going to meet with the clinicians after this meeting to engage them on the issues that they were raising yesterday in the picketing, and will continue meeting with our internal and external stakeholders. I'm also appealing to our communities. I think you have seen there's an advert that went out on hospital boards, because when you have those governance structures in place, they are able to pick up these things at an early age before they become a crisis, so that we can be able to intervene. So I'm appealing to our communities that please participate in these boards. The advert is out. It will be closing on the 18th of March, where we'll be able to appoint new boards. On the same breath, I want to thank all the hospital boards that were there for the time that they have served. And I know that the one at the very same hospital, which is Bara, they were very functional, and they were raising issues, and I don't know how they missed this one on the bread. And also to thank all those COVID-19 posts, or the nurses and doctors that were appointed on the COVID-19 grants, that if I had budget, I would retain all of them, because they played a crucial role, critical role, when we were really struggling as a province and as a country. But unfortunately, we cannot appoint all of them. We will be waiting for the CEOs, because there was a meeting that was held on Tuesday. We'll be waiting for the CEOs to submit their needs, and then we'll be able to then appoint those ones that the CEOs would have prioritized. And I know that there's a high unemployment rate, and for them to lose what they were at least earning, it's really not nice. But since we are not even sure whether we are going to have a fifth wave or what, But I'm also encouraging them that when there are positions that are advertised, they must also apply. And I really don't know what to say. It's really sad to let go of the people that really made an impact and really put us well.
Right, we'll have more news for you at the top of the hour. Do stay tuned.